Alberta Premier Jason Kenney is taking new action to avoid what he calls a hard lockdown. After a week of rising case numbers, his government is bringing in what Kenney calls targeted measures. And that could mean curfews for some Alberta communities. The province is now reporting a new single-day record of new COVID-19 cases, 2,048, a sharp spike from the day before. Active cases in the province are now at a record high, too, 21,385. That tops the peak reached last December when Alberta was hit by the second wave. Laura McQuillan leads off our coverage this hour, once again with more on the Alberta picture. Good morning, Laura. Let's talk about the situation there.
Yeah, the situation, John, pretty worrying when you compare it to the rest of the country. In the past few days, we've seen a number of other provinces fall backwards in terms of their number of active cases, but Alberta's has continued to grow. We'll show you a map. Here you can see the Alberta situation, the darker red there, outstripping any other province, including Ontario, which has seen its active cases fall back in recent days, but Alberta just keeps growing. And that's what prompted these new measures announced by Premier Jason Kenney yesterday. Just a couple of measures applying to 8 cities or municipalities, and those measures are moving high schools to online learning only, elementary schools will stay open for the time being, and closing indoor fitness. Those measures will stay in place for at least 2 weeks, but as you mentioned, John, the province also considering a curfew for areas with especially high numbers of cases. Those areas right now, there would be 4 of them, and they would include Fort McMurray and Banff, based on the number of cases that they are seeing at this point. No word on whether a curfew will happen. It will be done if those areas request it from the province, and yet to give any details on what it might look like. Right across the province, however, cracking down on enforcement and telling people if you receive a fine for breaching public health measures, if you were at a gathering, for instance, if you don't pay that fine, you will not be able to use provincial services like renewing your driver's licence. So that's a step we have not seen in other parts of the country before. It comes just a day after Premier Jason Kenney rejected calls for stricter measures. Doctors already saying that these new measures may only have a minimal effect. They've been calling for a sharper lockdown for several weeks to get the numbers down. And just a short time ago, John, you spoke with Dr. Isaac Bogosh, infectious disease specialist, asking him whether these measures would be enough, and he said in response to that, it's really hard to say. Take a listen.
When your case levels get to be so high, when your hospitals are starting to get threatened beyond capacity, unfortunately, keyword unfortunately, you have to use more blunt tools, and those blunt tools often come in the form of a lockdown. No one likes lockdowns, they stink. But sadly, you don't have many options left. Surgical approaches just aren't as effective in those situations, unfortunately. So, I mean, sure, maybe it's worth a try, but I hope they're nimble and can pivot if need be.
And so, Laura, we're learning that healthcare workers may soon have to make some tough decisions about who gets care. Tell us about that. That's
right. Our colleagues at CBC News in Alberta have learned that healthcare workers are getting briefed this week on triage protocols. We've spoken about this in Ontario previously. Now it's happening in Alberta. Decisions on who will get life-saving care if hospitals are stretched past their capacity. And a memo from Alberta Health Services, which was shared with CBC, describes that protocol as a guide for the, quote, difficult determination, that's their words, about allocating care or resources to critically ill patients when there simply aren't enough resources to go around. Our colleagues spoke with Dr. James Talbot, who is the former Chief Medical Officer of Health in Alberta, about what that could mean in a real-life situation.
If you're in a situation where you have 5 COVID patients who need a respirator and there's only 3 respirators, how do you choose? That's what this triage protocol is set up to do. So the fact that they're going to be briefing people on that protocol this week suggests that they think that this could get a lot worse.
A pretty stern warning there. Alberta Health Services told us there's no plans to activate that protocol at this point in time, saying they do believe they have enough hospital capacity. But when you look at the ICU numbers, 151 people in ICU as of yesterday. At the second wave peak, it was 153, so getting very close to what they saw just a few months ago when things were especially bad. Alberta cutting back on surgeries in Calgary, Edmonton, its northern zone, and James Talbot, who you just heard from, telling us that it could be only a matter of time before hospitals exceed their capacity if these restrictions or even more restrictions don't have a big impact, John.
Thanks for this, Laura.